Dr. Terry Grossman, thank you so much for taking this interview and taking your time. We really appreciate everything you're doing for Radical Life Extension. It's fantastic. So what did you like most about RadFest last year?
Well, it's unique in terms of the fact that it's the only meeting of its kind that's specifically designed for individuals that are embracing the idea that we are, in fact, on our way towards a true revolution in life extension. The concept that immortality really lies within the lifespan of many of us now alive today. So it's really a unique event. It's not for healthcare practitioners. It's not for professionals. It's for people that are interested in basically seizing this opportunity and learning more about it for themselves.
Thank you. Thank you for that. Can you give us a little brief summary of what new exciting information you're going to bring to RadFest 2017?
Medicine is changing so radically. When I wrote the books that I've written with Ray Kurzweil over the years, we talked about the three bridges. Bridge one being the therapies that were available, basically, which is now in the past. It was the present when we wrote them. And we talked about the future, which was bridge two, biotechnology, things like stem cell therapies and things like genomics. Well, just mentioning those two, which were a dream for the future when we wrote the books. For instance, I personally had a stem cell treatment done on myself within the last couple months as a rejuvenation treatment. Medicine, the bridge two medicine, which was a dream, 8 or 10 years ago, we're now actually on that bridge and utilizing these therapies in clinical medicine.
Yeah, beautiful.
And then bridge three, which is the nanotechnology revolution, we're on the verge of that. There are many nanotechnologies that are now becoming common.
It's not just necessarily a quantum leap into, immortality. There are steps, and people can understand that, because people have a hard time understanding, that they can just say make that quantum leap into immortality or extreme or super longevity. This gives them really steps to take. I love that. That's beautiful.
Well, I think it is going to be at one point, it actually is going to be a quantum leap.
Well, yeah,
and I think
that's right.
What we'll see is in the not too distant future, we are going to be able to basically create a backup copy of ourselves, in which case we have, created human immortality, physical human immortality. And I think that's very realistic in the near future.
Yeah. So you were at RadFest, like we said, last year. You really seemed to enjoy yourself and gave a great presentation. Why do you think people should attend RadFest this year?
Well, you're putting together a collection at RadFest of some of the most forward-thinking individuals, and you've done it in a very compelling and entertaining way. It's not just a matter of sitting, listening to hour after hour of lecture. You have integrated virtually all of the senses in terms of music and dance and community. I mean, it's a spiritual meeting. It's just on so many levels. It's not just a conference, it's an experience.
Yeah. Thank you very much. Yes, that exemplified the whole concept for sure. So you are a great thought leader also, along with being a great naturopathic doctor. Is that your specialty actually is naturopathic work for the most part, or natural medicine, preventive medicine?
Natural medicine would describe what I do, although I'm not hesitant to use prescription drugs. Naturopathy, or being a naturopath, describes a different type of physician than I am. I'm actually a MD medical doctor, not a naturopath. I've taken the approach of trying to use natural methods as much as possible, although using the best of conventional or unconventional medicine, which is to say, if there are prescription drugs available, like I've been a big advocate of the use of metformin for many years. This is a prescription drug that is the number one leading drug for treating type 2 diabetes in the world, yet I recommend it for many of my patients, and I've been taking it myself because it mimics the effects of caloric restriction, one of the best ways we know of improving longevity. So things like that, I try to incorporate into my practice and to share with my patients as well.
Yeah, super. So You have a really good sense of community. I get that from you. You travel all around, you meet with a lot of people, you collaborate with people. How important is it, do you think it is to have collaboration? And I'll use the term, the power of togetherness to help end aging and death.
Aging is the one disease that affects all 7 billion of us on Earth. So it's the one disease process that at present has killed everybody that's ever lived. So we're looking basically to find a cure for this disease that we refer to as aging. So I would think that all 7 billion of us have an interest in this. And I think all of us are going to be working together on that. And I think 7 billion minds are much better than one.
Absolutely. Wow. Wow. Well said. Well, thank you. Thank you very much, Terry. Great interview. Is there anything you'd like to add to this interview that I haven't asked you?
No, I really appreciate, Jim, all of your efforts, and the opportunity to speak again at RADFest this coming year.
Excited to see you again and hear you. So thank you very much. Great job.
Okay, thanks, Jim.